Hello everyone, welcome to my video. So today I'm gonna explain about food and drug interaction. So the contents of my videos are what is drug and food interaction and why is it really important, how the drug and food interaction influences pharmacokinetics, and what are the mechanisms of interaction between food and drugs, what are the clinical consequences of the interaction, and the patient's counseling point. So first of all, what is drug and food interactions? It's an interaction occurs when the foods or drink that has been consumed affects the way a medication works in the body. So there are three types of interactions. We have pharmacokinetics, pharmacodynamics, and direct chemical or physical interaction. But in this video, we're only focusing on pharmacokinetics. So in the simplest way I can explain, pharmacokinetics is what the body does to the drugs. So there are four parts, important parts in pharmacokinetics: absorption, distribution, metabolism, excretion, or shortlisted we can call it ADME. So what are the importance of this interaction? First, it is really essential in drug development and labeling. Second, it can ensure therapeutic effectiveness. Third, it can prevent adverse drug reaction or side effects. Fourth, we can support individualized patient care. The fifth, improve medication adherence, and the last one, to prevent treatment failure. So you might be wondering how food and drug interaction influences drug pharmacokinetics. From the absorption, the food delayed gastric emptying and also altered the pH, and then there will be the interaction of drug and food components altering the first pass metabolism. In the distribution, the changes in plasma proteins levels due to food may influence the duration of drug binding. In the metabolism, the food can induce or inhibit drug metabolizing enzymes, especially in liver and guts. While in excretion, there will be changing in urine pH, alter ionization and reabsorption, affecting fluid balance. So let us know what are the mechanisms of interactions. In my video, we're only focusing on diuretics and high potassium foods. So now let us know what are the diuretics that we might have known before, but it's okay, I will explain more. So there are two types of diuretics, which is potassium wasting diuretics and potassium sparing diuretics. Potassium wasting works to increase renal excretions of potassium that are caused by the increase of sodium delivery and aldosterone activity. So this will cause low blood potassium levels. But for potassium sparing, it will reduce renal excretions of potassium and increase serum potassium levels. This is caused by the decrease of sodium delivery and aldosterone activity, causing high blood potassium levels. So, what are the effects on pharmacokinetics of the diuretics when the patient taking high potassium foods? So there are such as the examples of high potassium foods like avocado, banana, and more. So it can affect the pharmacokinetics of the diuretics, but not too much. For potassium wasting, there are no major change at all to the pharmacokinetics of the diuretics. Meanwhile, for potassium sparing, also there will be no major change on absorption, distribution, and metabolism of the drug. Meanwhile, for the excretions, there will be slow drug excretion, and half-life of the drug might be increased, and there will be high risk of drug toxicity. You might be wondering why there is no effects on pharmacokinetics on potassium wasting diuretics. So when the patient are on potassium wasting supplement or medications, there will be a massive excretion of potassium from the body, causing low potassium levels in our serum or protein plasma. So when patient taking high potassium foods, so the high content of potassium will balance the amounts or the levels of potassium in our body. So there will be no low or high potassium levels in the body, causing a balanced reaction inside of our body. So moving next, what are the clinical consequences? So for potassium wasting has a positive effect because high potassium foods balance the low level of potassium in body after increase of potassium excretion. So it will maintain normal electrolyte and improve drug tolerance. But if there is insufficient intake, it can cause hypokalemia. For potassium sparing, High potassium foods increase the level of potassium more in the body, causing hyperkalemia. You might be asking, what is hypokalemia and hyperkalemia? Hypokalemia is occurs when the level of potassium in our body is extremely low. Meanwhile, for hyperkalemia occurs when the level of potassium in our body is extremely high. We can see the symptoms of hypokalemia, such as muscle cramps, fatigue, constipation, irregular heartbeat, high risk of digoxin toxicity. Meanwhile, for hyperkalemia, there will be muscle weakness, paralysis, fatigue, nausea, irregular heartbeat, slow heart rate, and severe cases, there will be cardiac arrest. So, what are the patient's counseling point? So, people are advised to monitor serum potassium levels regularly. As front-enders, we need to educate patients about diet drug interactions, and we need to give an advice to them to avoid high potassium foods or supplement if on potassium sparing diuretics. Meanwhile, they can consider potassium replacement or dietary advice is if they are on potassium wasting diuretics. So that's all of the explanation of my video. You can refer to all these references so you can know more about my topic that I already explained in the video. They have more also about the references. So thank you so much for watching my video. See you later.